Welcome back to your Pediatric Dentistry channel Tiny Talks. If you are new to this channel, subscribe the channel. For details of this channel, visit the bio section, or you can also check out my first video. Sorry if there is any mistakes in videos or shorts. Today we will discuss the prenatal and postnatal growth of mandible. Prenatal growth of mandible start at the 4th week of gestation with the formation of the first pharyngeal arch, and 6th week of gestation with the formation of Meckel's cartilage. So starting with the formation of mandibular arch, which begins around the 4th week of gestation, the mandibular arch forms from the first pharyngeal arch, and these arch give rise to the structures of the lower face including the mandible. Then there is a development of Meckel's cartilage. The mandible develops from the Meckel's cartilage, which is part of the first pharyngeal arch. By the 6th week of gestation, a rod made up of hyaline cartilage surrounded by a fibrocellular capsules extend from the ear region to the midline where the mandibular processes from the both side meet and fuse is known as a Meckel's cartilage. Then there is a mesenchyme condensation occurs. So mesenchyme is a type of embryonic connective tissue. Condensation of the mesenchyme occurs around the cartilage, setting the stage for the bone formation. Then around the 7th week, the bone formation begins in the center of the mandible. This process directly turns mesenchymal tissue in the bone without a cartilage stage because of the mesenchyme condensation. The newly forming bone spreads forward and backward along the side of the Meckel's cartilage. Then bone trunk formation. So bone structures from the both side of the mandibular process come close together but stay separated in the midline symphysis region until birth. Posteriorly, ossification continues until it reaches to the point where the mandibular nerve divides. Then development of alveolar plates. So medial and lateral alveolar plates. These plates grows upward surrounding the developing tooth jump, providing support for the future teeth. Then there is a formation of ramus. The part of the mandible called the ramus develop as the ossification rapidly spreads backward into the mesenchyme of the first arch, turning away from the Meckel's cartilage. Then there is a condylar process development. Around the 5th week, a cone-shaped area of the mesenchymal condensation appear in the front part of the developing mandible, and by about 14th week, these areas start ossifying and eventually fuse with the ramus to form the condylar process, a crucial part of the joint. Then accessory cartilages, coronoid region. Cartilages appear in the coronoid region but they disappear before birth, and when these cartilages appear in the chin area, they can form the small bony structures called mental ossicles. So first, at the 4th week of gestation, there is a formation of the first pharyngeal arch which form the mandibular arch, and around the 6th week of gestation, there is a formation of Meckel's cartilage. After that, there is a mesenchymal condensation which sets the stage for the bone formation, and at the 7th week, the bone formation start at the center of the mandible with the formation of alveolar plates and the others. Coming to the postnatal growth of mandible. So mandible is the most diverse bone in the human craniofacial structure as it is made up of many small individual bones which on their own are mini skeletal units. This postnatal growth of the mandible is best understood if the development of all parts of mandible is undertaken individually. So first, condylar cartilage growth. So condylar cartilage located at the back of the mandible is a primary site for postnatal growth. This cartilage undergoes endochondral ossification. So endochondral ossification is a type of bone formation where bone develops by replacing hyaline cartilage. This process is responsible for the formation of long bones such as those in the arms and the legs and many other bones in the body. This cartilage undergoes endochondral ossification where cartilage is replaced by bone, and the condylar cartilage continues to grow and contribute to the lengthening of the mandible. Growth may either occur by bone deposition along the condylar cartilage which then interacts with the cranial base, thus displacing mandible downward and forward, or it may occur as a growth of soft tissue surrounded in the region later followed by the bone formation. Then the ramus growth. The ramus, the vertical part of the mandible, grows significantly postnatally. Ossification spreads rapidly into the mesenchyme of the first arch, turning away from the Meckel's cartilage. This rapid ossification contributes to the height and width of the ramus. Deposition on the posterior aspects and resorption on the anterior aspects to move the ramus posteriorly to accommodate for molars and to accommodate increasing muscle mass of masticatory muscles. Alveolar ridge development. The alveolar ridge which supports the teeth continues to grow and remodel postnatally. Bone depositions and resorptions occur to accommodate the erupting teeth and enlarging muscles of the mastications. Body. Due to the resorption of ramus, the old ramal bone changes to posterior body limb. Bone depositions also occurs along the inferior margins of the body of the mandible, thus lengthening the mandibular body. Lingual tuberosity. These move posteriorly by deposition along the posterior surface. Resorption is below the lingual fossa. Angle. Lingually, there is a resorption on the posterior inferior aspects and deposition on anterior superior aspect. And buccally, there is a deposition on the posterior superior aspects and resorption on the anterior superior aspects. This results in the flaring of angle of mandible. Coronoid process. Depositions occur on the lingual surface and further growth is based on the enlarging way principle that take place posteriorly. Chin. Bone resorption occur in the superior aspects over the concavity in the mental region. There is a Jort's concept of jaw rotation. So according to this Jort's landmark longitudinal study, the mandible undergoes a downward and backward rotation during growth, with greater growth occurring posteriorly and anteriorly. This rotation affects the overall shape and position of the mandible and has an implication for orthodontic treatment planning. There are some influencing factors. So first, muscles of mastication. The development and enlargement of the muscles used for chewing play a significant role in the mandibular growth. These muscles exert forces on the mandible influencing its shape and the size. Tooth eruption. The eruption of the teeth stimulates further growth and remodeling of the mandible to accommodate the new teeth, and this process ensures the proper alignment and occlusion of the teeth. Functional appliances. Orthodontic appliances can alter bone growth by changing soft tissue pressures. These appliances are used to guide the growth of the mandible in case of malocclusion or other dental issues. These are the references. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursday evening 6 PM and Sunday morning 11 AM. Also, we try to put MCQs according to topics on our shirts with answers and explanation if needed, which will help you in Viva or NEET exam. Like, share and subscribe the channel. Thank you.